Hi, this is Dr. Milescu. So in this video, I'm going to highlight the bones of the hand and figure out the names. So there's a way to the madness because there are quite a few carpal bones here that there are to learn. Specifically for the practical, you'll just have to know a little bit about it, but you don't have to memorize absolutely all of them. I would say there's a method to remembering the names, which we're going to go over. You should know the metacarpals, which we're going to go over, and that's quite simple. So we're going to start with the thumb. So the thumb is special. It doesn't have all the phalanges that the other ones have. Oh, there goes a bone. So this here is the first metacarpal, and this is called the proximal phalanx, and this is the distal phalanx. The phalanges are your digits or your fingers. Now take a look at the second, third, fourth, and fifth. You have a proximal, a middle, and a distal phalanx. So proximal, middle, distal phalanx. Proximal, middle, distal phalanx. Proximal, middle, distal phalanx. Proximal, middle, distal phalanx, okay? So all you have to remember is that the only one that doesn't have three phalanges is your thumb. So your thumb only has a proximal and distal phalanx, no middle. Now let's go over the metacarpals. C for hands, and then tarsal, metatarsal, we're gonna go over, that's foot. So the metatarsals are in the foot, so you can remember toes, right? Toes are in the foot. And then in the hand, we have metacarpals. So this is the first metacarpal, second metacarpal, third metacarpal, fourth metacarpal, fifth metacarpal. Now, if you look at the palmar side versus the dorsum of the hand, okay, it looks very different. As you can see, you can learn it one of two ways. You can learn it from the dorsal side, or you can learn it from the ventral side. All right, or you could say posterior or anterior. So let's start first from the thumb, okay? So this is the first metacarpal. With the first metacarpal, the first carpal bone that articulates with the first metacarpal is trapezium. Next to the trapezium, right here, with the second metacarpal is the trapezoid. So trapezium, trapezoid. The middle metacarpal articulates with the third carpal bone, and that is called the capitate. So capitate, so trapezium, trapezoid, capitate. And then this one kind of looks like a hammer, as you can see there, so that's called hamate. And then your fifth carpal bone, which is just lateral to your fifth metacarpal, kind of hangs out. You can feel that bump right in here. You can feel it right in there. You can feel a little bump. That's your pisiform. It sits on top of the triquetrium. See that? So it's two bones in one. So a very non-pretty way to, and politically incorrect way, is you piss on the toilet. That's how I remember it. Pisiform and triquetrum. So pisiform, triquetrum. Okay, and then as you go down here, the next one is lunate because it starts to look like a half moon. So here it is, kind of looks like a crescent moon. And then the last one to remember is the scaphoid. So to review one more time, trapezium, trapezoid, capitate, hamate, pisiform, triquetrum, so piss on the toilet. And then right here looks like a half moon, so lunate. And then right dead center is going to be the scaphoid right here. And then we come right back around. All right, so I went pretty much counterclockwise with my right hand and then clockwise with your left hand. And those are the carpal bones. For the purposes of the practical, you don't have to memorize every single one of these, just remember the carpal bones, but you have to know all the metacarpals, and you have to know that the thumb only has a proximal and distal phalanx, whereas fingers 2, 3, 4, and 5 have a proximal, middle, and distal phalanx. All right, that's it for the hand. Next video, we'll go on to the next bone. Good luck studying. We're 1 week out. Keep going.